and nitric oxide. So the loss of nitric oxide is what sets the stage for the inflammation, oxidative stress, and immune dysfunction that occurs over many, many years in the development of cardiovascular disease.
Hello, Dr. Bryan. You are the founder and CEO of Bryan Therapeutics and a foremost expert on nitric oxide. So welcome to Modern Healthspan, and thank you so much for joining us today.
Well, thanks so much for having me. It's a great honor and pleasure to be with you.
Thank you, Dr. Bryan. So I think to start with, could you introduce nitric oxide a bit? I think people have probably heard about it, but I'm sure there's an awful lot that we have not heard about.
Sure. Yeah, nitric oxide is, I think today recognized as one of the most important molecules produced in the body of humans. It's a signaling molecule, meaning that it's how cells in the body communicate with one another. Nitric oxide's primary role is regulating blood flow and circulation. So it's a vasodilator, meaning that when it's produced, it opens up and dilates blood vessels so you can improve oxygen delivery, improve basically nutrient delivery to every organ, tissue, and cell in the body. It's how the neurons in the central nervous system in the brain communicate with one another. It's a neurotransmitter, but it's also a critically important molecule in our own immune system. It's how our immune cells fight off invading pathogens from bacteria to viruses. So again, it's a signaling molecule. It's a gas. Once it's produced, it's gone in less than a second. But during that second, it starts a number of cell signaling pathways that's really involved in nearly every biological function in the human body.
Right. So I've certainly heard of the vasodilation before, but some of the others I have not. So it's a signaling molecule. So where is it produced? Is it produced in the endothelial cells, or is it kind of consumed in the endothelial cells?
Well, it's produced in many different cell types. It was first discovered in the endothelial cells, and the endothelial cells are the cells that line all blood vessels throughout the body and our lymphatic system. And there's an enzyme called nitric oxide synthase that's found in our endothelial cells. And it's that enzyme that's responsible for the production of nitric oxide, which regulates blood flow and vasomotor tone in every vascular bed in the body. But it's also found in our neurons. So there's different isoforms. There's eNOS, the endothelial NOS is called eNOS, the neuronal NOS is called nNOS. And then there's what we call the inducible enzyme that's found in our immune cells, like macrophages, neutrophils, monocytes. And those are the enzyme that's responsible for, inflammation, wound repair, killing pathogens. But now we know that these different isoforms are found outside of endothelial cells, and the enzyme is found in the epithelial cells that line our GI tract, the nasal epithelium, and the upper airways. So this enzyme is present in many different cell types, and it's responsible for a host of important biological functions.
So I guess what turns it on? What causes it to generate the nitric oxide? Sorry.
Yeah, well, there's a number of different activators and stimulators of nitric oxide production. For once, nitric oxide is part of the insulin signaling pathway that takes up glucose and clears it from the circulation. So insulin will activate it. Sheer stress, like when we begin to exercise, that turns on nitric oxide production. There are agonists like acetylcholine, that's a normal agonist in the lining of the blood vessels, that turns on nitric oxide production. Things like histamine, to improve blood flow to, from a pathogen, or to induce increased what we call hyperemia, or increased blood flow to a certain area. And so there are a number of different agonists and stimulators of nitric oxide production. But the issue is always that if the enzyme becomes dysfunctional, then you no longer get activation. And things like testosterone and estrogen will stimulate and activate nitric oxide production. But if the enzyme becomes uncoupled and dysfunctional, then we lose the production of nitric oxide, even when activated or stimulated by these agonists. So that's really the underlying problem in nitric oxide-based signaling. It's the loss of the ability to produce nitric oxide when activated or stimulated.
Right. Rather than the ability to recognize it at
That's
the
right.
receiving end. Okay. So why would we lose the ability? Why would NO synthase cease to work?
Well, it's an enzyme. So today we understand the enzymology of that biochemical reaction. But in simple terms, we have oxidation. And oxidation is we basically lose an electron or lose the ability to maintain normal electron flow to produce nitric oxide. So the rate limiting step in nitric oxide production by this enzyme is when a molecule called tetrahydrobiopterin, or BH4, becomes oxidized. And when that becomes oxidized, the NOS enzyme falls apart and we lose the ability to make nitric oxide. And collectively, we call that endothelial dysfunction, right? So the inability of the endothelial cells to produce nitric oxide is now recognized as the earliest event in the onset and progression of most, if not all, chronic diseases, including cardiovascular disease, the #1 killer of men and women worldwide. So we understand that we can prevent the uncoupling of the NOS. We can actually restore normal endothelial nitric oxide production. But to answer your question, there's really a number of things that contribute to that. It's a poor diet. A high sugar, high carbohydrate diet leads to glycation of the enzyme. Eating inflammatory foods, being exposed to different toxins, all that leads to oxidative stress, which leads to NOS uncoupling, reduced nitric oxide production, which then leads to increased inflammation and immune dysfunction and further oxidative stress. And those are the hallmarks of every chronic disease.
Okay, so I think maybe if we could think about this a bit, because it seems to be so kind of all-encompassing, right? It's difficult to kind of wrap my head around this at the moment. But if we thought about specific illnesses, right? Specific chronic illnesses. So, I mean, like Dr. Attia calls them the four horsemen, like dementia, CVD, metabolic syndrome, and cancer, I think, or diabetes. So if we took CVD, so CVD is particularly related to, like endothelial health and
That's right.
and the vasodilation. So how would low NOS impact CVD? And I think I've seen other talks where you talk about how it's not only does it cause the vascular to dilate, but it also reduces plaque or it reduces the buildup. So could you talk about how it does that? Because I think that would be a key part of.
Yeah, no, look, it's very clear, and cardiovascular disease is a great example because #1, it's the #1 killer of men and women worldwide. It's a huge problem. And #2, we have a very clear understanding of what causes the onset and progression of cardiovascular disease. So in a healthy blood vessel, we make sufficient nitric oxide. So we can make nitric oxide, it dilates the blood vessels, and it keeps the blood vessels soft and compliant, which with each heartbeat, we basically dampen that pulse wave. And so nitric oxide is what keeps the arteries open. It's what keeps them compliant. But when you lose the ability to produce nitric oxide, so let me step back in. The onset of cardiovascular disease is really when monocytes and neutrophils and platelets start sticking to the lining of the blood vessel. They migrate through, they cause smooth muscle proliferation. You get fatty cells, foam cells, plaque deposition, and then plaque rupture, and that's heart attack and stroke. So that's the entire sequence of events. But the earliest stages of that is microvascular inflammation. And nitric oxide, so the loss of nitric oxide is what sets the stage for the inflammation, oxidative stress, and immune dysfunction that occurs over many, many years in the development of cardiovascular disease. So as long as the blood vessels can make sufficient nitric oxide, then you don't get an upregulation of adhesion molecules. The monocytes and neutrophils don't stick. You don't get the fat deposition. You basically prevent smooth muscle proliferation, which would cause hyperplasia. And then you basically completely prevent the onset and progression of cardiovascular disease. But when you lose the ability to produce nitric oxide, you lose the vasodilatory effects. You start to get an increase in the expression of certain adhesion molecules. And that's what sets the stage for monocytes rolling, adhering, migrating through the endothelial cells and then causing the immune dysfunction, which leads to plaque deposition, plaque instability, and plaque rupture. So that's the entire mechanism of the onset and progression of cardiovascular disease. So what does nitric oxide do? It maintains vasodilation. It prevents the upregulation of adhesion molecules. It prevents platelets from clotting, and it prevents the inflammation that causes plaque rupture. So as long as we can maintain normal nitric oxide production, we can prevent the onset and progression of cardiovascular disease. And that's really the simplicity of what we're doing here. Everything we know about cardiovascular disease, heart attack, stroke, can be explained by a loss of nitric oxide production. And so that's, addresses the number one killer of men and women worldwide. But we certainly have a clear understanding of nitric oxide's role in diabetes and insulin signaling. We have a clear and defined role for nitric oxide in dementia and Alzheimer's. And then certainly there's a clear role for nitric oxide in modulating mitochondrial function and cancer cell proliferation. So what we call the four horsemen, or the four major causes of death around the world, there's a clearly defined role for nitric oxide in each of those processes.
Yes, certainly. So could you talk a little bit more about metabolic syndrome?
Yeah.
Because I believe NO is related to the way insulin works.
That's exactly right. Yeah, metabolic disease is a worldwide pandemic. 93% of the people in America, and probably these data will translate into the global, because most international or countries have become westernized, right? They've adopted the Western lifestyle of diet, and they're suffering from the same diseases. So when insulin, we call this insulin resistance, right? So the cells become resistant to insulin signaling properties. And in 2009, we published the first paper showing that nitric oxide was part of the insulin signaling pathway. So when we eat, a sugary meal or a high carbohydrate meal, we see an increase in blood sugar. That tells the pancreas to secrete insulin to basically clear sugar from the circulation. So insulin is secreted from the pancreas. It's circulated throughout the entire body. There's insulin receptors on every cell in the body, but its highest concentration are on muscle cells, on liver cells, and on fat cells. And those are the three primary cells that basically improve insulin or glucose uptake and clear it from the circulation. But part of the insulin signaling is when insulin binds to insulin receptors, it starts this intracellular signaling cascade, which the terminal step in that is GLUT4. There's a protein that's cytosolic, and then it goes to the membrane and it binds glucose and brings it into the cell. Well, part of that signaling is dependent upon the cell's ability to produce nitric oxide. So when insulin binds, it turns on nitric oxide synthase, and then if the enzyme is coupled and functional, then that nitric oxide binds to the GLUT4, leads to post-translational modification, and that's necessary and sufficient for GLUT4 translocation and to clear glucose from the circulation. That's how insulin signaling and glucose uptake works in a healthy person with normal metabolic function. But if the cell can't make nitric oxide, then GLUT4 never gets the signal to go to the membrane to bring glucose into the cell, and so you develop insulin resistance. So there's a breakdown in communication, and that's what leads to insulin resistance. So you have hyperglycemia. Now it tells your pancreas to secrete more insulin. Now you have the hyperinsulinemic response, and it's the hyperinsulinemia and hyperglycemia that leads to the entire inflammatory cascade of metabolic syndrome and diabetes. And so we showed it and demonstrated in our 2009 paper that if we can just give nitric oxide or restore the production of nitric oxide, then you can potentiate insulin signaling, you can overcome insulin resistance, and completely rescue the metabolic phenotype of diabetes and insulin resistance. So all of this signaling and communication is dependent upon the cell's ability to produce nitric oxide. So when you lose the ability to produce nitric oxide, not only do you develop high blood pressure and erectile dysfunction and dementia, but you start developing metabolic disease, insulin resistance, type 2 diabetes, or even type 3 diabetes, which we know as Alzheimer's.
Right. So you talked about a 2009 paper. So has this been used in any human trials? And how would you, and kind of what have you seen? I mean, are there any FDA approved NO treatments?
Not yet. We're working
Not
on
yet.
that through my company,
Okay.
Bryan Therapeutics. We have a number of drugs in clinical trials now through the US FDA. But to answer your question, anecdotally, we see this, but we haven't developed any randomized placebo-controlled clinical trials on diabetes or metabolic syndrome. Because I think we're going against some very powerful forces, and this one target, one drug model that most drugs are developed against doesn't work in our paradigm, right? Because nitric oxide is what we call a pleiotropic molecule. It has multiple targets. It does multiple things. So what we do is we design clinical trials to demonstrate safety and efficacy in certain disease indications. So our first indication would be for ischemic heart disease. Because in patients with ischemic heart disease, ischemia means low blood flow, right? And so ischemic heart disease is low blood flow to the heart. And the low blood flow to the heart is due to obstructive coronary disease. So the coronary arteries become occluded with plaque. They're chronically constricted. And so when you start to exercise, there's not enough blood flow getting to the heart, and you develop angina or this ischemic pain that we call angina pectoris. So our drug study is if you take ischemic heart disease patients, we treat them with our nitric oxide drug. And if we can demonstrate that we can prolong exercise-induced angina, then that's an effective therapy. We've already demonstrated safety. So this will be a phase 3 trial for ischemic heart disease. And then our next study is looking at Alzheimer's, because as I mentioned before, nitric oxide gets to the root cause of Alzheimer's. Because Alzheimer's is characterized by decreased blood flow to the prefrontal cortex, what we call focal ischemia, and it's a disruption in glucose uptake. So it's insulin resistance in what we call diabetes type 3. So nitric oxide improves glucose uptake, potentiates insulin signaling, improves cerebral blood flow, and those are the hallmarks of Alzheimer's disease. And if you can restore blood flow and maintain normal glucose uptake and insulin signaling in the brain, then you don't get protein misfolding, you don't get the amyloid plaque, you don't get the tau tangles, and people maintain normal cognitive function. So we think, well, we don't think, we're pretty confident, we believe and perhaps even know that nitric oxide will be the ultimate treatment for vascular dementia and Alzheimer's. And that's just a short list of indications that nitric oxide would affect. We also have, indications for heart failure, pulmonary hypertension, metabolic disease, diabetes. So we have to tick these off one by one and go through the rigor of randomized placebo-controlled clinical trials for each indication. But the science tells us that there's really not a single indication where nitric oxide would not be beneficial when given at the right dose, at the right time, in the right patient.
How do you deliver acute NO? I mean, I assume it's not gaseous.
Well, now that's been the trick, and really the hurdles we've had to overcome, because, as I mentioned earlier, nitric oxide is a gas. And the only FDA approved indication for nitric oxide therapy is giving nitric oxide gas through a nasal cannula, and this is only approved for premature babies with pulmonary hypertension. And so you deliver that in an inpatient setting, and you can use it off-label for adults with, undergoing cardiopulmonary bypass surgery to maintain some oxygenation of the blood while you're bypassing the lungs. So that's been the challenge, is how do we deliver bioactive gas? And, that's been my claim to fame, is I'm the only person who's ever made a solid dose form of nitric oxide gas. So we do this in the form of an orally disintegrating tablet. So I made a tablet that you put it in your mouth, and it has a resident time of about 5 to 6 minutes. So as it's dissolving in the mouth, we're generating this bioactive gas. And so it's absorbed buccally, it's transported throughout the body. We can see dilation of the carotid arteries within 12 to 15 seconds. We see peak plasma concentrations within 15 or 20 minutes. So we have the entire pharmacokinetics and pharmacodynamics completely elucidated. And so that's how we deliver this bioactive gas, is through this orally disintegrating tablet. And then we've also made a topical nitric oxide, which we can deliver transdermally, that we're developing that for diabetic ulcers and non-healing wounds. So to answer your question, we figured out how to deliver this bioactive gas in a solid dose form.
Interesting. And I was going to ask you about the skincare because I saw that there what you did have a topical. So how does kind of the topical work, and what does it work on? Would it work on? I mean, so you talked about like wounds, but would it work on other skin issues?
Yeah, absolutely. So the topical is we've created a dual chamber nitric oxide delivery. And so when you combine these two ingredients together and mix them, they start to generate nitric oxide gas. So, the skin is an organ. In fact, it's one of our largest organs. So similar to the heart, if we have decreased blood flow to the heart, that heart fails. If we have decreased blood flow to the skin, well, that organ will eventually fail. So what does a failing skin look like? Well, you lose collagen, you lose hydration, fine lines and wrinkles appear. You start to develop acne, dermatitis, rosacea, eczema. Really, any dermatological issue can be described by a loss of blood flow, a loss of the immune response, a loss of barrier function. So all that's controlled and regulated by nitric oxide. So similar to the fact that if your body loses the ability to produce nitric oxide, then we've got to provide a source of nitric oxide for you. And that's what the topical does. So if the cells of your skin can't make nitric oxide, then when you mix these two components together, then we do it for you. And then the nitric oxide gas will penetrate and diffuse into the upper layers of the skin. It'll recruit capillaries, dilate blood vessels. We've got 5 published clinical trials on the topical. We see, improvement in collagen deposition, fine lines and wrinkles go away. Patients with acne, especially polycystic acne, it kills the bacteria in the pustules, lowers the inflammation, regulates blood flow. And so, yeah, we see enormous effects in really any type of dermatological issue. But I think we're most excited about the topical drug for diabetic ulcers and non-healing wounds, because in these non-healing wounds, there's decreased blood flow. That's why the wound doesn't heal. And typically, there's an infection in that wound, because if there's no blood flow, then we can't mobilize our immune cells to kill the infection. So the topical nitric oxide is antibacterial. It'll kill most, if not all, bacterial infections in non-healing wound. But it starts to open up the blood supply to the wound. So now you can get tissue granulation. You can mobilize an immune response, mobilize stem cells, and now the wound heals itself. And we've seen 4- and 5-year-old non-healing wounds that we can heal with our topical nitric oxide in a period of a couple of months. So it's going to be a game changer in wound care. In the U.S., there's over 60,000 people that die every year in nursing homes from infected wounds. And to me, that's simply unacceptable, because we now have safe and effective technology that can not only kill the infection, prevent the sepsis, but actually heal these wounds that were previously unhealable.
Interesting. Yeah. So turning for a second, well, yeah, turning to kind of how things work normally rather than how things work when how things go wrong. Right. So how do we get nitric oxide? How do we get the raw material to make nitric oxide in the body?
Well, there's two pathways that make nitric oxide in the human body. The one we discussed previously was this enzyme found in the endothelial cells and found in basically all cell types. And so we have to maintain the function of that enzyme. So we know how to do that. There's a certain electrical potential we have to apply to prevent the oxidation of BH4 that maintains NOS coupling and NOS function. And so that's what our product technology does. It basically prevents the oxidation of BH4, maintains normal endothelial function, so you can continue to produce nitric oxide when needed. The other pathway is through the oral microbiome. We and others discovered, 20-something years ago that there are bacteria that live in the mouth on the crypts of the tongue that are responsible for producing nitric oxide. And so we have to maintain that normal diversity and ecology of the microbiome. And so these bacteria are responsible for metabolizing inorganic nitrate, which is found in green leafy vegetables and beets and some root vegetables. And so humans don't have an enzyme to metabolize that molecule, nitrate. So we're dependent upon the oral bacteria. And so what we're finding is that people with periodontal disease, gingivitis, the entire diversity of the microbiome becomes disrupted. So the bad guys outcompete the good guys, and that's what leads to gingivitis, periodontal disease. And now we know that there's an oral systemic link, that people with poor oral hygiene have systemic disease. right? Higher incidence of heart attack, stroke, and cardiovascular disease. And so for years, we thought it was just translation or translocation of those infectious bacteria into the bloodstream, causing, inflammation and causing systemic disease. But now what we're realizing is it's not just the presence of the pathogens, but it's the disruption of the non-pathogenic commensal bacteria and the disruption in nitric oxide production. So what we're finding is that people who use mouthwash, and there's 200 million Americans that wake up every morning and use mouthwash, and that destroys the microbiome. It shuts down nitric oxide production, and it leads to an increase in blood pressure, inflammation, oxidative stress, and immune dysfunction. So now we understand that hypertension is really a symptom of oral dysbiosis. And so we have to get people off mouthwash. We have to stop doing things that are antiseptic because, as you know, now with the microbiome project completed, the bacteria that live in and on our body outnumber our human cells 10 to 1. And so we have to maintain this healthy microbiome. And we all know today that we can't take an antibiotic every day for the rest of our life because of the destruction it does to the gut microbiome. The same principles apply. You cannot use an antiseptic mouthwash every day for the rest of your life without consequences. We're finding that if you use mouthwash, your blood pressure goes up, people are starting to develop erectile dysfunction, and you lose the protective benefits of exercise. So you have to get rid of mouthwash. The other problem is fluoride in toothpaste. Fluoride is an antiseptic. It kills the bacteria in your mouth. And so you have to use a non-fluorinated toothpaste. So get rid of fluoride, get rid of mouthwash, allow the oral microbiome to flourish, to repopulate, and it produces nitric oxide, and it's regulating systemic blood pressure.
Excuse me. Yeah, I saw that you did one trial that I thought was really interesting, which is you took some young, healthy people and you got them to take mouthwash and their blood pressure went up, significantly up.
Through the roof.
Yeah, that was really amazing. Okay, but there is another part of the system, which is the stomach. So like
That's right.
Yeah. So can you talk about that? Because that can also, if that's disrupted, then we're still not going to create our nitric oxide.
No, that's exactly right. So what we've told you is part of the story, right? And so like Paul Harvey says, now I'll tell you the rest of the story. And so part of that pathway, when the bacteria start metabolizing nitrate in the oral cavity, then when we swallow our saliva, we have to have sufficient stomach acid production because you need stomach acid to absorb nutrients like iron, selenium, chromium, B vitamins, and you need stomach acid to break down proteins into amino acids. But I think most importantly, you need stomach acid to make nitric oxide and to basically complete this cycle of taking the nutrients we get from the foods to ultimately producing nitric oxide. And so without stomach acid, you basically inhibit nitric oxide production. And then the problem now arises when patients take antacids. And there's a specific class of antacids called proton pump inhibitors, or PPI. These are things like Prevacid, Prilosec, Nexium, Omeprazole. And there's 200 million prescriptions written for these drugs every year. And now you don't even have to have a prescription for these. You can go to the corner store and buy these over the counter. And now people have been taking these proton pump inhibitors for 5, 10, 15, 20 years. And the data are very clear now that patients who have been on these proton pump inhibitors for 3 to 5 years have about a 40% higher incidence of heart attack, stroke, and Alzheimer's. So those are undeniable clinical observations, increased risk of heart attack, stroke, and Alzheimer's. And now if we work backwards and figure out why that is, we understand that it's a complete inhibition of nitric oxide production. So these drugs completely inhibit nitric oxide production and shut down nitric oxide from both pathways. It uncouples the NOS enzyme, leads to an increase in ADMA and asymmetric dimethylarginine, which inhibits nitric oxide production, and then it inhibits nitric oxide production from swallowing our own saliva. So these drugs are extremely dangerous. They should be taken off the market, and patients have to find a way to get off of antacids because your body cannot and will not heal, cannot produce nitric oxide if you're taking antacids.
Right. Yeah, it is true. Yeah, I mean, you could take something to increase the stomach acid, but then that would rather defeat the purpose of taking the antacid in the first place.
No, that's right.
So one thing I saw in your book, yeah, so I read your book. One thing I saw in
Well,
there is the kind of the quantity of vegetable. There seems to be some quantity of vegetable, and you seem to need a certain amount for it to start working, like 400 grams or something in a single sitting. Can you talk a little bit about that? I mean, how can we be sure that we're getting enough nitrates?
Well, this whole field of nutritional epidemiology tries to identify what is it a part of certain dietary patterns that confer protection against cardiovascular disease or cancer. And so for years, the nutritional epidemiologists thought, well, the benefits of a plant-based diet or Mediterranean diet is the antioxidants that's formed in these. But when you try to deconstruct this and do clinical trials by giving the antioxidants in certain dietary patterns, you fail to recapitulate the effects of those diets. So we and others put forth this whole kind of hypothesis that perhaps it's the nitrate content in these dietary patterns and food choices that then leads to an increase in nitric oxide production that confers the cardioprotection and health benefits of certain dietary patterns. And so in order to do that, then you have to ask yourself, well, how much nitrate do we need to see the benefits of those diets? And you can just do a simple literature review, and we find that you basically need 300 to 400 milligrams of nitrate per serving or per meal. And then that allows for this really inefficient reduction into nitric oxide that confers the health benefits. So then the next question was, well, how much broccoli or celery or spinach or certain food groups would I need to eat in order to achieve that 300 to 400 milligrams of nitrate that would then lower my blood pressure and afford the protection from the diet? And so we went to 5 cities around the US and we just grabbed vegetables off the shelf. We brought it back to the lab and we measured it. And what we found was that there was regional differences in the nitrate content of these vegetables. So the nitrate content in vegetables grown in Dallas and Los Angeles may be 50 to 100 times higher than what we find in Chicago or New York or Raleigh. So these regional differences in the nitrate content really don't allow us to predict or make recommendations on how much broccoli, celery, or spinach you would need to eat, because it depends upon where these vegetables are grown, the soil conditions, and then the other kind of important consideration is that organically grown vegetables have about 10 times less nitrate than conventionally grown. Because in the US, to get an organic label, number one, you can't add herbicides or pesticides to the crops, which is a good thing, but there's also restrictions on nitrogen-based fertilizers. And if the soil is not standardized to a certain amount of nitrate or nitrogen, then you can't assimilate nitrate, you can't assimilate other nutrients. So organically grown vegetables are typically depleted in not just nitrate, but other important nutrients. So there's a strong balance here that we have to have nitrogen in the soil, but we can't add herbicides or pesticides to this because they're poisons and they're destroying the microbiome in the humans and causing a lot of systemic disease. So to answer your question, we really can't predict on how much vegetable of any given vegetable we would need to eat to achieve a certain threshold of nitrate, which would then lead to nitric oxide production in the human body.
Interesting. Yeah, I mean, it'd be interesting to go down the kind of what the best path, what the best way of growing vegetables is, but I think that would be a diversion. So I was thinking, like, if you do exercise, or I think red light as well, it can also raise nitrogen oxide, nitric oxide production. But all of these are kind of dependent upon you having the nitrates in the first place, because otherwise you don't have the substrate.
It's dependent upon a number of things. Number one, having enough substrate around from the diet in terms of nitrate, but you also have to have the systems in place that are functional to metabolize these precursors or substrates into nitric oxide. So for nitrate, you have to have the right oral bacteria. For exercise, you have to have not only the right bacteria, but also a functional NOS enzyme in the lining of the blood vessel. And so what we're finding is that if the enzyme is coupled and functional, when we start to exercise, that activates the enzyme, we get nitric oxide production, and that's why exercise is medicine, because it stimulates nitric oxide production. But if you don't have a functional NOS enzyme and we begin to exercise, we don't get nitric oxide being produced we don't get the subsequent vasodilation, and that's diagnostic for ischemic heart disease, right? Because if you start to exercise, you have to dilate the coronary arteries in order to increase the oxygen delivery to the working myocardium. And if you can't make nitric oxide, you can't dilate the coronary arteries, so you basically develop ischemia and angina. So you develop exercise intolerance. People can't maintain a normal exercise regimen. And then a couple of years ago, it was reported that if you use mouthwash and you exercise, you lose the protective benefits of exercise. So the bacteria in the mouth are responsible for responding to exercise and increasing nitric oxide production. And still, they're still trying to figure out the mechanism of that, is how is activating endothelial nitric oxide production through activation by exercise, what are the oral bacteria doing in response, that if you kill the bacteria through mouthwash, you lose the protective benefits of exercise. And that creates a whole new kind of quandary in medicine, because I know people that eat primarily a plant-based diet, they exercise, they do everything we were known to do, but they're using mouthwash. And yet if you eat right and do exercise, but you're using mouthwash, you completely eliminate the benefits of a plant-based diet, of a Mediterranean diet, of a Japanese diet, and you basically lose the protective benefits of exercise. So we have to stop doing the things that disrupt nitric oxide production and then allow the body to produce nitric oxide on its own. So now when we exercise, when we do deep breathing, the body can actually produce nitric oxide, and you see the physiological effects.
Yes, that makes sense. Maybe that's why all the diet papers come up with different answers to the same question.
That's exactly right. There's so many confounding factors in there, and nobody's ever asked about mouthwash use, because you see the commercials, use mouthwash. Listerine kills 99.99% of the bacteria that cause bad breath. Well, yeah, they kill 99% of all bacteria, the good guys, the bad guys, and there's consequences to that. So people have to stop using mouthwash. It's deadly. It leads to a decrease in nitric oxide production. And if you're not accounting for that, and in our 2019 paper, we basically describe this as the mechanism of resistant hypertension. Because people who have high blood pressure, they go to their doctor, they're put on different classes of antihypertensive medications, but yet 50% of the people that are treated with hypertensive medicines don't respond with better blood pressure. And the reason they don't respond is it's perhaps that their hypertension is due to oral dysbiosis. So now if we start to ask the patients, do you use mouthwash? Do you have fluoride in your toothpaste? And most of the time people say yes. So we go, okay, stop using mouthwash, get rid of fluoride in your toothpaste. And 30 days later, they come back and their blood pressure is completely normal. And now for the first time, you can start getting patients off of prescription medication. Because once you restore the function of the human body and normal physiological response, then there's no need for drug therapy. So we have to start asking the right questions on, number one, are you eating a sufficient diet? Number two, are you on mouthwash or have fluoride that's completely disrupting normal metabolic function? And then, maintain normal endothelial function and NOS coupling. So those are the fundamental questions we have to ask every patient. And then and only then can you start to interrogate the systems and figure out how do we restore normal function.
Thinking about aging, so we get older. So does nitric oxide levels decrease with age? And if so, do we know why?
Yes and yes. So,
okay.
If you look at population-based studies, you'll find that the older we get, the less nitric oxide we make in the lining of the blood vessel. So we have to parse these two pathways. So the first one, the function of the NOS enzyme is what becomes dysfunctional with age. And the reason it becomes dysfunctional is because of oxidative stress and oxidation of BH4 and NOS uncoupling. But we now know that doesn't have to be the case, right? Because we know what leads to NOS uncoupling, we know what causes endothelial dysfunction, and now we can employ strategies to prevent that. And so I'm typically the all-important N=1 experiment, the guinea pig, if you will. And so I've done these studies, and so I turned 50 in November, but yet I have the vascular age of a 32-year-old. So we know how to prevent this age-related decline in nitric oxide production. And then, we see kids that are 20, 25 years old that have a vascular age of a 60 or 70-year-old. So you can accelerate or decelerate this entire process based on what we know about the enzymology and the biochemistry of nitric oxide production. So the answer is yes. In the normal population, we typically see an age-related decline in nitric oxide production, but it doesn't have to be that way. And now we can basically employ the dietary pathway, the harnessing the oral bacterium that can overcome the loss of production in the lining of the blood vessel. So one can compensate for the other, but when you lose the ability to produce nitric oxide in the lining of the blood vessels and produce nitric oxide due to oral dysbiosis, then we see a global nitric oxide deficiency, and that sets the stage for all chronic disease.
How can we tell whether we are low on nitric oxide? Is there any kind of test or any measure?
You know, it's a great question, and it's really a question we've been trying to provide answers to for the past 30 years. Because nitric oxide's a gas, so it's not something you can draw blood and get a number like your total cholesterol or vitamin D levels. Because nitric oxide is, once it's produced in the body, it's gone in less than a second. I mean, in the research lab, we can measure different metabolites of nitric oxide and get a pretty good indication of nitric oxide production. But we have to mainly rely on symptoms. You know, I developed a salivary test strip about 15 years ago that was the only point of care non-invasive diagnostic for nitric oxide. So what we're testing is salivary nitrite and the presence or absence of these oral bacteria that can metabolize inorganic nitrate from the diet. I've gotten away from those because we're finding that patients with oral infections have false positives. So they may have a local immune response due to an active oral infection that may lead to a false positive. So to answer your question, we have to rely on symptoms. So the symptoms of nitric oxide deficiency, and there's a hierarchy, right? So these occur at different stages. But the first sign and symptom of nitric oxide deficiency is erectile dysfunction. Because if you lose the ability to produce nitric oxide in the sex organs, you lose the ability to dilate those blood vessels, so you don't get engorgement, and you lose the erectile function of the sex organs, and that's in men and women. So if you've lost the ability to produce nitric oxide in the blood vessels that line the sex organs, it's a systemic disease. Now you've lost the ability to dilate the blood vessels in the coronary arteries, in the cerebral arteries, and every vascular bed throughout the body. So that's number one, erectile dysfunction. Number two, your blood pressure starts to go up. And 2 out of 3 Americans have an unsafe elevation in blood pressure. And I think these statistics are probably global now. And if you don't correct that, then you start to develop insulin resistance and diabetes, metabolic syndrome. And then if that's not corrected, you start to develop vascular dementia and Alzheimer's. You lose the regulation of blood flow to the brain. And then you develop exercise intolerance. You can no longer maintain a normal exercise regimen. And then you develop plaque deposition, plaque instability, plaque rupture, heart attack, stroke, and typically that's the end of the story. So if you have these symptoms already, then that tells us that you've been nitric oxide deficient for a period of time, right? And if you don't take steps to restore normal nitric oxide production, you're going to be a statistic of the number one killer of men and women worldwide, which is cardiovascular disease and the resulting heart attack and stroke. So we have to be able to recognize nitric oxide deficiency early on before you develop erectile dysfunction, before you develop high blood pressure, and certainly before you develop metabolic disease and Alzheimer's. And now we know how to do that. We know how to restore nitric oxide production, recapitulate nitric oxide signaling. So there's no excuse. We know how to address all of these chronic diseases.
So could you look at your vascular age, like the pulse wave or whatever, and it would show a high age, and that would indicate that you are low on NO?
That's right. Yeah, there's a number of medical devices, functional devices that measure what's called flow-mediated dilatation or reactive hyperemia. And the gold standard in that is basically you can occlude blood flow to the brachial artery for 5 minutes. And then when you release the cuff, if your blood vessels dilate, then that tells us that that vascular bed can make nitric oxide, and that's called reactive hyperemia. So that tells us how well your blood vessels are making nitric oxide. There's other devices called non-ischemic plethysmography where you can look at kind of the structure and function of the blood vessels through pulse wave analysis and look at the reflective wave at how soft and compliant or stiff your blood vessels are. And then there's algorithms out there that can assign a kind of a vascular age based on that response. The other thing you can do is look at what's called carotid intima media thickness, or CIMT, in the carotid artery. And you can see at how much, plaque or smooth muscle proliferation or hyperplasia is occurring in those blood vessels. And again, that will give you a vascular age. But if you have smooth muscle proliferation or hyperplasia and some degree of stenosis in the carotid arteries, then that tells us again that you've been compromised in the ability to produce nitric oxide for many years, because the functional loss of nitric oxide precedes these structural changes that you see through smooth muscle proliferation and stenosis by many years. And so, yeah, to answer your question, there are ways and methods and devices where we can assess vascular age based on the structure and function of the blood vessels.
So, but one of the other things is, as you mentioned, it's very difficult to know whether you're getting enough nitrate in your diet. So, right. Are there any supplements? Can you like eat fertilizer or something like that?
There's better ways.
Yeah, that's good.
Yeah, so we make standardized nitric oxide products that basically, number one, if your body can't make nitric oxide, our products do it for you. But we also provide that standardized threshold of nitrate and nitrite that's needed so that the body can utilize those to make nitric oxide. But otherwise, most supplements on the market, there's hundreds of beetroot products and green vegetable products on the market. I've tested these, and probably 95% of them don't provide any viable source of nitrate or nitric oxide activity whatsoever. So, consumers have to beware, because there's companies out there trying to sell you beet products and beet capsules and beet gummies and chews that really provide no nitric oxide benefit whatsoever. So to answer your question, most of the supplements out there that are marketed towards nitric oxide do absolutely nothing in terms of producing nitric oxide if you consume them.
Right. But beetroot is beetroot, I think we call it, is one of the better nitrate sources.
Well, it can be. It can be, but again, it depends upon the soil in which the beets are grown, the time of harvest, and then the other kind of challenge with creating a finished dried beetroot product or powder is that you take what's called a Hybrix concentrate, which is almost like molasses, then you have to dry that. And most companies will use high heat, high temperature, high pressure, and you basically destroy the nutrient density of that. So the finished product, and again, I've tested most, if not all, the beet products on the market. And 95% of them, there's no detectable nitrate or nitrite in that finished product. Now, is it because of the soil conditions? Is it because of the drying conditions? Is it the time of harvest? All of those we don't have the answers to, but the end result is the finished product that consumers are buying. It's basically a dead beet product. It provides no nutrient quality or no nutrient benefit whatsoever, and it certainly provides no nitric oxide benefit. The only thing it does is turn your pee and your poop red and pink and cause a lot of anxiety. And in fact, we use a lot of these products as our placebo in clinical trials because it's a great placebo. It's beets, but it provides no nitric oxide benefit.
Right. So the other thing is you need the right oral microbiome.
That's exactly right.
So do we know which species, although I guess to some extent it doesn't really matter which species, but are there any particular probiotics that people could take if you've been using mouthwash for a while and it's like, okay, well, I need to like get these bugs back? Is there a way, do we know a way of kind of accelerating that?
Yes. So we've identified and characterized these bacteria. There are probably half a dozen to a dozen primary species that are present and responsible for reducing nitrate to nitrite and nitric oxide. So the good news is in our 2019 paper, we found that if you're using mouthwash and you stop for 4 days, much of the oral microbiome has completely repopulated. So if you just stop using mouthwash, now these bugs can flourish and repopulate, and you can maintain a healthy microbiome. But there's ways you can accelerate this. So number one, you can add more nitrate to your diet, more green leafy vegetables. But again, we don't know if the vegetables you're eating provide sufficient nitrate to provide any prebiotic or probiotic effect. Uh, but I haven't found any probiotic or prebiotic on the market that can restore the production of the non-commensal or the non-pathogenic commensal bacteria that we've characterized. But here's what we're finding out. The lozenge that I created, this orally disintegrating tablet that sits on the top of the tongue and you move it around, seems to be a very good prebiotic and a probiotic, because the most pathogenic bacteria are sensitive to nitric oxide. So when we're generating nitric oxide in the oral cavity, the pathogenic bacteria, the nitric oxide binds to the iron sulfur centers of the respiratory cycle and basically shuts down their respiration. Where the good commensal bacteria are basically use nitrogen to respire on. So they're insensitive to nitric oxide. So the beauty of what we're doing by creating nitric oxide in the mouth, we're selectively killing the pathogenic bacteria and maintaining the diversity of the oral microbiome and replenishing these nitric oxide producing bacteria. So the lozenge itself may be the best probiotic or prebiotic to restoring the normal flora that we found. So there may not be a need for any other probiotic or prebiotic to restore the microbiome. Just stop using mouthwash, get rid of fluoride, and the lozenge seems to do the trick.
Right. So the bugs are either already there or they come in on vegetables or something. But
yeah, so these are facultative anaerobes, meaning that if oxygen's around, then they'll use oxygen to respire.
Right.
If oxygen becomes limiting, then they'll use nitrogen as an energy substrate and basically perform that 2-electron reduction of nitrate to nitrite. And, this is an interesting observation too, because mouth breathers, obviously are bypassing normal nitric oxide production. So mouth breathers fully oxygenate the mouth, causes complete oral dysbiosis. People who eat a lot of sugars or gummies or chews, change the ecology in the oral microbiome, lowers the pH, now allows for the, more pathogenic caries-causing gingival plaque bacteria to repopulate, causing oral dysbiosis, oral disease, and ultimately systemic disease. So we have to be able to close our mouth, breathe through the nose, the upper nasal sinuses, to activate nitric oxide production and basically maintain normal oral pH and that ecology in the oral microbiome.
Right. So this lozenge, is that the drug or is that a supplement?
Well, the product we have on the market today is a dietary supplement.
Right.
And so that's called the N101 nitric oxide activating lozenge. But we're taking that same core technology and developing it into drug therapy. So just like you can take, Tylenol over the counter, and you can get a prescription for a more potent Tylenol, or same thing for, naproxen or naproxen. There's OTC doses and there's drug doses. So we've had dietary supplements on the market for a number of years, but now we're taking that same core technology and developing it into drug therapy. So we'll maintain the two kind of product categories. The beauty of the dietary supplement is readily available. You don't need a prescription. And it's designed to enhance the normal structure and function of the human body and restore nitric oxide production. But we can't obviously make disease claims because it's not a drug. What we're doing with our drug program is we're going after specific indications that when we demonstrate safety and efficacy for that drug indication, then the FDA will grant us drug approval, and now physicians can write a prescription for our nitric oxide drug for that specific disease indication.
Right. Okay. And then this is available on the N101 website. Is that's
right?
channel?
So it's www.n101.com, and it's the letter N, the number one, the letter O, number one.com, N101. It's not N101. There's some squatters out there who bought this website that try to take a lot of the traffic from it. So it's not N101.com, it's N101.com.
Yeah. Yes, I saw that. And we'll put the link in the description and make sure we get it right. Yeah. Okay, that sounds great. Was there anything that you would like to cover that you think I haven't? I mean, there was a lot that I didn't get around to actually,
Yeah.
but
Well, I think when we look at, health span and longevity, we're finding that nitric oxide is foundational for not just improving lifespan, but improving health span. And when we look at kind of the three main objective measures of longevity, there's telomeres, right? The ends of the chromosome that get shorter telomeres, shorter lifespan. There's mitochondria. We need a higher number of mitochondria per cell that can utilize oxygen to make energy more efficiently. And then there's the mobilization of our own stem cells. So aging is really, we're constantly wearing ourselves out. We've just got to repair and replace dysfunctional tissues and cells. And that's the role of stem cells. So we find, and we now know that nitric oxide is the signal that tells our own stem cells to mobilize and differentiate. So if you can't make nitric oxide, your stem cells don't get the signal to repair and replace tissue. So we constantly wear ourselves out. So nitric oxide is absolutely essential for stem cell mobilization and repair and replacing dysfunctional cells. Nitric oxide also activates the enzyme telomerase, which prevents telomere shortening. And so now there's clear evidence that longer telomeres, longer lifespan. So if you can prevent telomere shortening, then you can prevent early death. And nitric oxide is what controls and regulates the enzyme that prevents telomere shortening. So if you can't make nitric oxide, then you get shorter telomeres, shorter lifespan. And then the third is mitochondria. Nitric oxide is what controls mitochondrial biogenesis and mitochondrial ATP production. So again, if you can't make nitric oxide, you have a lower number of mitochondria per cell, and those mitochondria become dysfunctional, and you basically develop fatigue, chronic fatigue syndrome. If you can maintain adequate nitric oxide, you can have a higher efficiency of energy production, higher number of mitochondria per cell. So the whole point here is if we can maintain normal nitric oxide production, we have better stem cell function, we have longer telomeres, and we have higher number of mitochondria. And that's really the basis for longevity. So it's really the unified theory of aging. Nitric oxide, maintaining nitric oxide production is absolutely foundational for living a longer, better lifestyle free of disease.
Great. Thank you. So actually I had, so one question came to me while we were talking. The topical version, is that available through your website, or is that only on prescription?
It is. So the topical product that we launched in 2019, and it's for skincare and beauty. So it's seen remarkable effects in fine lines and wrinkles and really the aging skin. But again, yeah, it's a dual chamber. You take one pump from each side, you mix it together, apply it to the face, neck, décolleté, and you'll see the skin turn pink. And so we call that the pneuma glow, but it's basically, that's a reflection of increased blood flow. So we're recruiting capillaries and we're forcing blood flow to any area where you apply the serum. But yeah, it's available on the n101.com website as well.
Excellent. Okay, great. So thank you so much for joining us. It was great that we finally connected.
Absolutely. Thank you, Richard, for being flexible and patient with me.
You are very welcome. So apart from N101, is there anywhere else where people can follow your work?
Yeah, I'm not here to sell products. I'm here to provide education and awareness around nitric oxide. So I send people, I have a dedicated YouTube channel. We'll place interviews like this and podcasts and lectures on my YouTube page. It's Dr. Nathan S. Bryan, Nitric Oxide. I've got an educational website, drnathansbryan.com. Got some videos on there that'll instruct and inform on nitric oxide. Those interested in keeping up with our drug program, that's bryantherapeutics.com. Yeah, and then those interested in product technology, n101.com. And I'm on social media, Instagram at Dr. Nathan S. Bryan. I'm on LinkedIn, Twitter at Dr. Nitric. And I'm certainly searchable by most search engines.
Okay, thank you. Dr. Nitric, it sounds like something from the Avengers. Just
That's right.
I'm not sure whose side you'd be on, though.
All right. We're the good guys.
The good guys or the bad guys, yeah. Dr. Nitric. Okay, thank you so much. It was great talking to you.
Thank you. Take care.